teaming each other throughout this. So Arundhati, over to you. Arundhati, can you hear us? Yes, unmuted. Okay, we'll just get you unmuted because we
Hi.
can't hear you right.
Okay.
Oh,
I
we can
think
hear.
someone unmuted me. Thanks. Thanks, Diana. Yeah, good morning, good afternoon to everyone. Great to join you here from India. So Diana, as she said, we are going to be talking about menstrual waste management and the connections and the implications for menstrual product standards today. But before we jump into that, we wanted to take a step back to define what menstrual waste is. And as you can see on this slide, menstrual waste incorporates menstrual blood and associated uterine and vaginal discharge, as well as the menstrual materials or products that are used to collect or absorb this kind of discharge. And in some instances, it also includes any material that may be used to wrap products before they're discarded. So this could be paper or plastic. So it includes all of these. And when we talk about safe management of menstrual waste, it's actually a series of steps from the time that a user, such as myself, discards a menstrual product all the way to its end of life treatment. But it also means that the menstrual waste is managed in a way that causes minimal harm or ideally no harm to those who menstruate, those who are dealing with this waste from collection to end of life treatment, as well as the environment, which is both air, soil, as well as water. So when we look at menstrual waste management, it's this entire value chain from disposal to the end of life treatment, keeping in mind implications for both health as well as the environment. Diana, next slide, please. Okay. So why are we so concerned about menstrual waste? So as you can see from the numbers on this particular slide, a person who menstruates, who's using any single-use product, may use anywhere between 5,000 to 15,000 such products over their lifetime. And this corresponds to a fair amount of waste, in terms of just the volume of waste and the waste and the weight of that waste. And a concern is because of the composition of single-use products, it takes a long time, hundreds of years, for these products to break down, and there are implications on the soil, on water, as well as for air pollution. Now, while this is important for us to know, we also want to reiterate that these numbers are not meant to stigmatize the use of single-use products at all. And we also want to put it out there that we acknowledge that menstrual waste is actually is a small proportion of the total amount of solid waste and plastic waste that is generated. But that said, as the use of single-use products increases in low and middle income countries, we need to be cognizant of how we can efficiently manage that waste. And in relation to that, we also need to be looking into how these products are made so that we can manage it efficiently. Now, if we look at South Asia, Diana said we're going to be focusing a little bit on South Asia and on sub-Saharan Africa as well. So South Asia actually leads the way in terms of the high use of single-use products, even though less than 50% of the population may be using those products. But because of the sheer size of our menstruating population, as you can see from these numbers, you have over 16,000 million menstruators who are using single-use products in full in South Asia. And as you can see, India leads the way. And now over to Diana to talk us through some of the sub-Saharan African numbers.
Thanks, Arundhati. Yes, so you can see from this, if you look at the sub-Saharan Africa, it's over 7 billion users. But what does that look like on a local scale? So I want to give an example. In South Africa, and also I want to point out, we want to consider the role that government plays in this and the role that standards play. So in South Africa, they recognized that in their no-fee schools, they needed to help provide access to the learners there with menstrual products. So they came up with a sanitary dignity implementation framework. And from 2019 to 2023, they provided 4.3 million disposable pads to the learners there in the school to meet their needs. So I took that number and thought, okay, what does 4.3 million look like in a year? If you break over, because that's over 4 years, you break that down, that's 860,000 girls that the government was able to help support. And then we looked at it one other way. Let's assume that a very conservative estimate that a girl uses 2 pads a day and for 3 days. Okay, so that would be pads that she would use. So what we did is we took that, and that would come out to be 61,000, or anyway, that big number, right? And so what I thought was, okay, what does that look like? How many pads is that are being, once they're done, what's happening with the waste management? So this is it. Let's assume this shipping container is a 20-foot container. I put this into AI, and it said to deal with that many pads per year, it would take 375 shipping containers. And these are new pads, so we know soil pads weigh more. And so then what does that look like over the 4 years where they gave to 4.3 million? It shows the pads over 4 years, 147 million thousand. That would take 1,500 shipping to handle that much product. So one of the things that the South African government recognized quite quickly with this framework that they developed was the waste management. And so they really turned to standards for two reasons. One, they thought the safety, they want to procure safe products for the learners in the school. And second, they knew they needed to offer other choices that could help reduce the impact of this waste management. So they then have a standard on reusable pads and on menstrual cups to help lessen this waste management. So standards have really come into play to help with the waste management with the South African government. Okay, so what happens when we know in most low to mid-income countries, there's limited access to formal waste management, which means that there's no way that people can discreetly, safely, and really with dignity manage their soiled products. And I think that is, these are just a few statistics to show that. In Sierra Leone, one study showed that only 14% of schools had facilities or methods where they could actually manage their soiled products. And in Nigeria, that's 9% of schools. And then in Uganda, one study showed that 80% of the women and girls there were putting them in pit latrines or just discarding them, on bushes and rubbish pits. Again, we don't want to have judgment, but what do you do when there's no options, right? They're forced to do this. And I think what happens with this menstrual waste management practices is it's really a reflection of how society views menstruation. Because these are the three things I always think of with menstruation. It's seen as secretive, shameful, and it's stigmatized. And so when that's occurring and you have nowhere to manage it or access to your soiled menstrual products, where you're going to put them, you obviously want to do it in secrecy. You want to hide it. You don't want to draw attention. And so that's what we're seeing in areas where there is no access to proper waste management. So these are a few examples that you can see that really then cause problems to the environment, to humans, and it's just unsafe. So they drop them in pit latrines and flush them down the toilets. You can say they discard them in open areas. What did someone say before, the flying pads? The burying them or burning them, which is hazardous, all the chemicals coming out. So these are things that we need to be aware of, and standards can really help with that. As we are looking at the standards, what is the whole life cycle of that pad, and what are we doing at the end to manage that? So I'm going to turn it back over to Arundhati to talk a little bit more about this, how it impacts the environment.
Thanks, Diana. So as you can see on this slide, and drawing from what Diana just said, there are implications for both the use of single-use products as well as reusable products and how they are discarded. So there are implications as these products, when they're discarded, they enter the waste stream, and there are implications when they enter the sanitation system. So if we look at the solid waste stream, they could be thrown into or discarded or dealt with in incinerators or burning chambers, but they can also be burnt to the open or thrown out into the open. And this means that they enter the soil system and the water systems, which has implications for health, as well as the health of animals, as well as sanitation workers. When we look at sanitation systems, as Diana said, if they are discarded into toilets and pit latrines, they can also choke the sewerage systems. And again, we see that this has implications for sanitation workers, waste workers, who are then left to kind of unclog these sewerage pipes and unblock latrines. But it could also lead that these products that enter into water sources, as well as that waste makes its way through sewage pipes. So at the end, we want to kind of reiterate that menstrual waste management and linking back to product standards, if they're dealt with inefficiently, then it has pretty significant implications for human health, the health of sanitation workers, as well as for animal life, in addition to the pollution to air, soil, and water. Next, Diana. But all hope is not lost. We do have solutions that are being tried across low and middle income countries. We're not going to emphasize all the solutions that exist, but we want to draw your attention to some key solutions which we think are very intimately tied with product standards. So one of the solutions, and this ties back to a very significant solid waste management strategy, which is let's reduce waste volumes. So one way in which we do this is to introduce reusable menstrual products, whether they're reusable cloth pads, period panties, menstrual cups, menstrual discs. And by using these reusable products, we are then generating lower quantities of waste. So that's one side. The other is to make products safer for disposal or more efficient for disposal. And here's where we see trackable pads or compostable pads, which lend themselves to better disposal. The second set of solutions that we have that are culturally sensitive or responsive, as well as contextually relevant, are things like deep burial pits, where burning is often a taboo. So one can construct deep burial pits at a household level, a school level, or at a community level. You've got burning chambers where burning is appropriate or acceptable. You can have burning chambers, which are fueled by wood or paper or any other locally available fuel, as you can see in the picture. And then you've got on-site or decentralized incinerator models, which run on electricity. Now, all of these can be used to deal with discarded menstrual products. But here's where quality standards for menstrual products begins to show and play a role. If we have products where we do not know the composition of those products, it has implications for the decomposed material if you put it into a burial pit. It has implications for the emissions if we're burning them in this burning chamber or in this electrically operated incinerator. Next, please, Diana. We also are seeing some very interesting innovations that are coming up. So the image to your left is one from Sri Lanka, which is a mobile-based app which allows users to access a disposal bag specifically for menstrual waste. So they can put their waste into that bag and they can seal it, and then that waste gets taken away to a centralized incineration facility. And to your right, you see an example from India, Pad Care Labs, which is like a waste to resource technology where pads are then recycled to retrieve both plastic, cellulose, and which can then be used for various things. Now, again, here, great examples of like a circular economy and efficient usage or dealing with menstrual waste. But it again kind of really brings to bear that what is the composition of these products and are we able to effectively deal or manage this waste? Next, please, Diana. Okay, Diana, back to you.
All right, there's a bit of a lag when I'm hitting there we go. Okay, thank you, Arundhati. So now the solutions need to be comprehensive and multi-pronged, and this is where standards really come in. And one of the things we can look at is how do policies and regulations impact this when we look at the whole life cycle, right, of the waste management. Um, Classification of menstrual products is really important. If it's being classified in the standard as a medical device versus a consumer goods, that can provide guidance on for the classification, how it's going to be handled at the end of its cycle. Is it biomedical waste? Is it going to be a solid waste? Also, menstrual health policy and procurement frameworks, they allow then for enforcement of the product quality standards. Like we saw in South Africa, my example, the South African government wanted to procure products that they knew were safe, effective for the learners in their schools. And so they really relied on that standard to enforce their policy. And we can link product types defined within the standard with appropriate waste management solutions. So if we have a combustible, we want to make sure that then it meets the needs at the end of that life cycle. And as this is slowly coming, the thing is we want to have innovative product solutions. Not only is that important for the environment, but also everyone should have an option of what to choose and what they want to use. And everyone has different needs. And so, as Arundhati implied earlier, reusable menstrual product standards are vital to know they're safe, they're effective, and also they can help decrease the waste in our environment. And then including test methods on standards for products with the innovative end of life solutions. So are these going to be flushable? And if they are, do they work? Yeah, we have 2 more points and we are done. Over to you, Arundhati.
Thanks, Diana. And taking on from there, our solutions also need to look at behavior change and capacity building for both users as well as those who are dealing with this kind of waste across that waste value chain. So, for example, consumer awareness regarding product composition and the implications for waste management, including waste reduction, are key. And this can be for single-use products as well as for reusable products. But again, reiterating what Diana said, this is not to say that we all need to shift to reusables. It's just that we need to be, all users and consumers need to be aware of what's in their product, as well as the range of products that are available to them. The second is that users also need labeling that helps guide them in their own segregation practices, as well as safe disposal practices. And lastly, this is more for manufacturers, that packaging solutions need to also provide enough guidance as well as support to enable waste workers to be able to deal with this waste as a separate line. Lastly, innovations is key, and we also need to look at innovations and standards for the menstrual waste management technologies that exist, and making sure that they link back or take into consideration existing standards for menstrual products as well. So with that, Diana, I'm handing back to you. Thanks, everyone.
Thank you, everyone.
Thank you, Diana. We once again apologize for that technical issue we experienced. So we only have one more presentation to go. Yeah, so we have a very interesting presentation next that I know most of us were really waiting for. And the presenter is doing the presentation online. She's called Catherine from Columbia University. During one of the sessions here, during break time, some of us were being interviewed here, and some people from the media were asking about what they've been seeing going on in the print media and social media about how safe the menstrual products are. And therefore, we're going to have a presentation from Catherine in terms of a recent research that was done on toxicity and quality of menstrual products. Catherine, I'm sure the audience, both online and physically present here, are really eager to hear your presentation. So welcome, Catherine.
Everyone, can you hear me and can you see my slides? Can
Yes,
you see my
slides?
slides? Okay, you see the slides. Okay, perfect. Thank you. Good morning to you and good. For me, it's 4:30 a.m. in New York, so it's very early. I just woke up. So I'm very sorry that I couldn't join in person. I would have loved to join in person, but I hope I still can fill you in a little bit about my recent research. And first, I would like to say for this part of the presentation, it's supported by the Gates Foundation and the UN Sanitation Hygiene Fund, and it's in collaboration with the Austrian Research Institute. They're doing part of the work looking at the chemical safety of menstrual products. So why is that important? And my expertise is mainly on metals and PFAS. And if you look at just when you say it about media and media presence, when you look at this is just coverage of media where we find in consumer products, all in different types of consumer products, where we find metals. And the very recent one on the left is toothpaste contains lead and other metals. Then there was another study which showed that consumer products like spices can contain lead. And then even your chocolate can contain metals. So metals are everywhere, and these are toxic metals. So that's the reality. And that's why we need to check where we find metals and toxic metals and what are their levels and what is the safety of those metals in these consumer products. So what we did, last year we did a studies on metals in tampons, and we found these type of metals, different types of metals in tampons in different concentrations. So I highlighted here 4 metals because it's arsenic in red, cadmium, mercury, and lead. The reason why these are 4 metals which the WHO has as in the top 10 chemicals we should regulate, and they're non-toxics because they cause cardiovascular disease, impact the kidney function, brain health, and many more, I mean, even leading to cancer. So, and then of course the question is then, if these toxic metals, what I just showed from these very recent articles about other products, food and consumer products, if we find them there, and can they be potentially in what I said in many different menstrual products? And actually, there was a study in 2023 which showed that in regular underwear, you can find metals. So this is the study where they looked at different toxic metals, for example, chromium 1, and as I mentioned, arsenic, cadmium, antimony, and lead. All of them are toxic. So that means if we can find them in just regular underwear, what does it mean about period underwear? So it means we should not only look at tampons or single-use ones, also reusable ones could have these metals, and we need to know how much and how bioavailable or how bioaccessible they are, and what's the risk factor. So why is it again important to study the metals? And I just want to emphasize that one more time. Cells and how they might change the cell viability of the vaginal cells. And if you think about this for a long term for women, that could have, as chemicals do, their endocrine disruptors, they can affect your reproductive health too. So we need to think about this in a bigger scale. So now what we did now is like, okay, what is the global access to chemically self-periodic products? From the tests. So we found this is the three metals, which what I said, they are listed by the WHO as chemical risk, and they're most of the time they're causing cancer. So it's arsenic, cadmium, and lead. So what we see here, the reason is we put the same scale so that you get an idea what is the distribution of these metals in the product. So most common is lead to the right. You can see, so that's all the products summarized, not by country. That's all from what we have analyzed so far. So what you see is tampon has the highest level, then comes reusable pads, single-use pads, underwear, swimwear, and then single-use seems to be, in terms of lead, the better choice. Cadmium levels are, it's great, they're very low. For arsenic in these menstrual products, they vary a lot. As you can see for the single-use pads, there's a huge variation of how much arsenic we can find in these products. Sorry. So now breaking it down by country, and I did not want to say which country these are because until we have completed the study, I would call them country A to country I right now. It will be many more so that nobody looks and say, oh, which country is the best? No, it's not. So the idea is if you look at lead and arsenic, breaking it down for the different products, what you clearly can see is in all of like looking at lead and looking at the pink bar, you can see always tampons stick out and has the highest levels of lead, regardless from which country they're from, right? Except country A has higher levels in single-use pads. But then if you look at arsenic, which is interesting, what I said, the single-use one, they are always high in every country. It's the highest level of arsenic in single-use pads. Okay, another metal which is rarely discussed is antimony. Antimony is often added to plastics, and the problem with antimony is another element which is quite toxic, and we have not tested before, but we included it in our panel this time. And what you can see here is by country, again, antimony levels in nanograms per gram. And you can see that some countries where we've received products from, they have extremely high antimony levels of 100,000 nanograms per gram. So the EU restricts antimony in textiles to REACH and Ecotext with a limit of 30,000 nanograms. So that means it's a factor of 3 higher than the Ecotext regulation, or yeah. And you generally have it more in underwear and swimwear, which makes sense because where more you have synthetic material, you will have more antimony. Tampons and single-use pads have much lower because they have major part is cotton, so that's why the antimony levels are much lower. So then that gives the question is like, which one would be the, so it's very complex. It looks like it's very complex because if we are going back to this one, you see tampons have more likely a problem with lead. Single use have more a problem with arsenic, and then everything which is underwear and swimwear have an issue with antimony. So you will find these metals in different levels in the different types of products. So to sum it up, I may make it very short. So to sum it up, it's like, yes, metals are detected in all range of menstrual products, and the concentration vary by the product type, which makes it, what I said, complicated in the sense to understand where is the safety, but what would be the recommendation of what should be used as a product. And okay, then of course the question is, what does it mean for the women using these types of products? Is there any risk. And that's what we're doing now with these levels we have assessed. We are using exactly those data and then measuring, doing a 3D vaginal model to understand what it would be for any menstrual product you insert. And we also have a 3D vulva tissue model because that would be more like when you use a pad and underwear to better understand what would be the metal absorption. And with that, I thank you.
Thank you so much, Catherine, for that presentation. I know your presentation will elicit some reaction or some questions from the floor. Could we be having any question for Catherine before we go to the next session, which is going to be a panel discussion? So we have 5 minutes, sorry. Anybody who may have a question for Catherine? Catherine, there's a question from the floor.
What are the timelines for the study?
Did you get the question?
You're on mute.
Yeah, no, sorry. Now it works. Sorry about it. So the timeline of the study is we hope to complete the first part by the end of this year for as many countries as we can. And the second part with the cell line 3D model study, so for another 1 year.
Hi, Catherine.
Hi.
Yehani from Sri Lanka. Yeah. So, will you be able to send us the results? Actually, we have contributed our tampons, single-use sanitary napkins, reusables, and also this natural rubber menstrual cup. So, we are looking forward to getting the results. So, that will be a thorough study for us as manufacturers and retailers. Thank you.
Yes, I'm happy to send the results. We haven't done the menstrual cups yet. That's still one we will do next. But once we have it, I will have to share it.
Yeah, the final question. Yeah.
Thank you, Catherine, for the presentation. It's Madhvi from Kenya. I wanted to find out two questions. Did you use the same quantities of products per country? And number two, did the countries produce those products or could they have been imported also?
Yes, that's an interesting question. Often, I can say from the EU, many products are produced in the EU or to countries close to the EU. Products can be a large mix of where they are manufactured. So that's something we will make another figure based on where they are manufactured and if we see a pattern of metals based on where they have been manufactured. So there are some local ones, and of course we try to cover, if there's any local ones, we try to get the local ones, but for some countries I can tell there was no local products available or were locally manufactured.
Thank you. Catherine, you can also confirm you'll share the presentation for those interested in looking at it later on.
Yes,
Okay.
I'm happy to do that.
So, so together with the other presentations, we're going to put them together and share with all the participants so that you can still review them at your own time. I know we are going a bit quickly, so there are some points you may want to come back and review later. So as we set up for the panel discussion, I kindly request my panelists to come. And one of us, we are going to have a quick energizer made in Ghana. Just a quick 1 minute energizer. I know you've been sitting from morning and It's just been between sitting and eating. So we want just a 1 minute energizer to prepare you for the panel. So I kindly request my panelists to come in front. Levi Kanene from Uganda, Elijah Kiwanuka from AfriPads, Francisca from the Uganda Standards Authority. Mr. Francis Ogola is joining us online. He's part of the panelists, but he's joining us online. So you can take your seats as Deborah gives us a quick energizer. Welcome, Deborah. So like I said, our last part of this conversation is going to be a panel discussion. And then we'll open it up for some question and answer. And before we start the panel discussion, I want to welcome Tanya to give a brief background on why we are here.
Thank you, Ken. Good morning, everyone. My name is Tanya Mahajan, and I'm representing the Bureau of Indian Standards here, part of the Indian delegation to ISO TC 338. And I just wanted to take a quick minute to give a little bit of background on the panel discussion and what we are doing as part of the TC. So during the last plenary session that we had, physically last year in 2024, we actually had a lot of LMIC participation for the first time, both in person, but also as part of the TC in general. And when we were present in person, we realized that there are a lot of challenges that LMIC, NSBs, as well as participants face and will be facing in terms of the adoption and rollout of standards. So we came together then to form a task group to coordinate on understanding what some of those challenges are and also coming up with potential solution pathways. And so we have a formal task group within the TC actually doing that now. And today, this panel discussion is going to give a little bit of an insight into what some of those challenges and potential solutions might be. So over to Ken to take this forward and help us get that insight.
Thank you, Tanya. So we'll have me join my team here. I'm not sure whether you're able to see us. We had requested for a raised platform, but unfortunately that was not provided. But most of us here let me just say we are visible. I wanted to use a different word, but let me not use that word. So we'll have a panel discussion for the next several minutes that will culminate into a set of question and answer session. And without further ado, I want to start by giving my panelists 30 seconds each to have a quick round of introduction, just your name, the country you're from, and anything else you wish, I think you may want to share with the team. Because I told you that we have a panel of 5 people. Mr. Ogola is joining us online. Maybe Joachim, you can unmute him so that he confirms he can hear us. Francis Ogola. And as we start the introduction, it's unfortunate that my panel only has 1 lady, but the good thing is that the room has more ladies than men. I've just done a very quick count, and I've noticed that ladies are 2/3 in this room. So we'll start with the ladies first, so you can introduce yourself.
Okay, good morning, everyone. I'm Francisca Frimpong. I'm with the Ghana Standards Authority, the Standards Directorate, and I handle the NMC for menstrual products and incontinence. Thank you.
Thank you. Thank you. You can go to Levi.
Good morning. I've already introduced myself before, and I'm from Uganda National Bureau of Standards. Thank you.
Good morning, good afternoon. Good afternoon. I'm Elijah. I work with AfriPads. We manufacture reusable sanitary pads and underwear. I'm part of the technical committee, which is working so hard to make sure that we have a standard that regulate the safety of menstrual products. Thank you.
Thank you.
Good day, everyone. Good day, everyone. Who are, available physically and those who are participating online. So myself, Shivakumar Subramaniam. I am from India, working at the South India Textile Research Association, which is basically an autonomous body carrying out research and development on textiles and including medical textiles. We have a Center of Excellence for Medical Textiles, and we have been approved by the Ministry of Textiles, Bureau of India, Bureau of Indian Standards to carry out the tests.
Thank you. Ogola, you can introduce yourself. Francis, you can hear us?
Yes, I can hear you. You can hear me?
Yes, continue.
Can you hear me? Can you hear me?
Yes. Proceed.
Yes, my name is Francis Ogolayo. I work with Ministry of Health in the Department of Standards and Regulatory Services. Yeah. I'm a senior principal registered nurse by profession.
Thank you, Ogola. So, Ogola is joining us online, and I think we can hear him well. Be participating in the panel. So the first part, the someone needs 2 minutes in the room. So when he's not speaking, you can just mute him and then mute when we ask a question. I think it's now okay. So I was saying that. Okay. Okay, so I think sometimes these are the challenges we have with the hybrid meetings. Sometimes you speak for 10 minutes only to notice that you are muted. So I was saying that the first part of this panel discussion will involve me asking my panelists a question, and then I'll also give a chance to the audience also to ask a question to the panelists, and then we'll wrap it up. And then after that, if you have any general questions about the event and what we are doing here, we'll pick out those questions and anything that we might also have missed on the chat. So this is open for both the physical attendees and those joining us online. So I'm going to ask my first question to Elijah. Elijah, you mentioned that you are a manufacturer. I presume you're an SME. Where would you classify yourself? As an SME or you're a large manufacturer?
We manufacture?
An SME?
Yes.
Okay, so my question is this. What are your biggest hopes and concerns about the adoption of ISO standards for menstrual products? And how can we ensure that they are practical and affordable, especially for local SMEs? With reference to the draft we are discussing here, you've seen that there are a number of requirements that have been proposed in that particular draft. So what do you see as hopes and concerns for you as an SME in terms of adoption of that standard once it is published?
Yeah, thank you. As a manufacturer, I just want us to maybe imagine a manufacturer based somewhere in LMIC, maybe Uganda, Kenya, who is utilizing the locally available raw materials, who is utilizing the homegrown cotton, 100% cotton. And then this manufacturer has to meet this proposed standard. But in doing so, they have to meet the costs of these safety assessment tests. So before this manufacturer gets their product on the market, they have to go through the extensive tests, as we have been discussing the entire week, which is very important. So the challenges that I see as a manufacturer or the hindrances that may come in and we need to have them addressed. Speaking directly to the proposed test methods, that this manufacturer, a small manufacturer from LMIC, has to ensure that the product is safe by adhering to the chemical safety requirements. A presenter in the earlier discussion shared a lot on the chemical concerns associated with menstrual products. So a manufacturer has to make sure that their product is free from all that has been discussed. They talked about presence of lead in synthetic products, presence of dyes, all heavy metals. All these, a manufacturer has to go through them. And specifically, a manufacturer that I have in mind from LMIC, one who is using the locally available homegrown cotton, may assume that maybe because this is cotton 100%, it is safe. However, it is not safe until it has been assessed, because we all know, a presenter shared about the waste management concerns that we have, not only limited to LMIC, but even in the high income countries, waste management. Once in a while, these hazardous chemicals end up in our environment, in our land. So even with a manufacturer using 100% cotton, they have a risk of these heavy metals getting into the plant tissues, and at the end, your 100% cotton is not safe. The assessments that still have to be considered, the biocompatibility. For a product to be safe, it has to go through these cytotoxic tests, the skin irritation and sensitization tests. It has to go through all these carcinogenicity tests. Not only those as well, we talked about the bioburden. These are the common microorganisms that may occur on the menstrual products. These pose a very big threat. So all these tests, in addition to the physical safety assessments, they come at a cost. And for a manufacturer, I have to keep that in mind. All these tests that have been mentioned come at a cost. For instance, the biocompatibility tests can go for as high as, can go for a minimum of 3,000 USD. This can be a significant cost to a manufacturer from SME perspective. The chemical tests can cost at least 1,500 USD. So at the end, you need a budget of at least 5,000 USD as a manufacturer to have your product on the market. This cost does not even consider the cost of having experts who should conduct the safety assessment, because for a local manufacturer, sometimes I've seen it, you are the CEO, and then you are the quality control person, and then you are the marketing person for a small business. So you are the same person, you may not have the capacity, your background may be in social entrepreneurship, but you don't have the background of toxicology. So you need to hire the services of a toxicologist. All this comes at a cost. In addition,
yeah, and I just wanted to cut you short there, maybe, and maybe bring in a different twist. You've clearly raised some of the concerns you have as a player in terms of adhering to the standard, which you've clearly mentioned may affect the end cost of the product. And of course, you are saying here that you want to improve accessibility, and cost is an aspect. So I wanted to ask, with the adoption of these international standards, apart from the challenges you are raising, do you think there could be some of the positives that we could leverage on? And if you were to provide maybe suggestions, what would be suggestions you would give in terms of tackling some of those challenges you've mentioned, so that you also try to look for solutions and not just to complain about the requirements you've put there? Because from the discussions, we noticed that those requirements, they're important, because we're not just looking at the accessibility and the cost, we're also looking at the safety of the users.
Yeah, thank you. Yeah, so we can't just come here to talk about the challenges. With all the challenges, it is just good for better identification of the challenges, such that we can define a clear way how we can address the challenges. So responding to your question, from the discussions, it is quite interesting that one of the resolutions yesterday was for the LMICs to have, for the Central Secretariat to work with the task group the national standards bodies and the manufacturers. We as well have to benefit from this. Capacity building can be in several terms. This can range from as low as training experts on analyzing what safety, what a safe product is, to as high as providing equipment. Another point is we can work hard as maybe the Central Secretariat or secure funding to have regional centers of excellence, such that maybe for East Africa, we have one point where we can have these tests conducted at maybe a subsidized rate, or we have a center where research is being done on specific products, maybe products that are common in one region can be studied fully, such that at the end we have a clear understanding of all these different products. So centers of excellence can be one good part. And then one other thing that can be done is for the team that is developing the standard, we can try as much as we can to make the standard very clear in the sense that we leave no room for ambiguity. Because a simple challenge like defining what constitutes a batch can multiply the cost of a standard by 3 or by more than that. Because we may want to test how often the requirement can state every batch should be assessed. But what is a batch? The enforcement people may come in and say a batch is anything you produce every week. So they want this local manufacturer to test their product 3 times or how many times. So the standard development team can make sure that everything is very clear and defined.
Thank you so much, Elijah. So I was intentionally starting with the manufacturer because from the standards point of view, normally we start with the product and then we come to the, we have the standard. So at this point, I want to go to the only lady in the room, not in the room literally, but in my panel here. And I want you to speak as somebody who comes from a low and medium income country. I know we've been using the term LMIC and some of the audience members may be wondering what you're talking about. So as somebody who is also a co-secretariat with the Swedish Institute for Standards in the training program, first of all, I would wish that you speak a bit about what the training program is. And even as you speak about the training program, I would want you to talk about we've heard here that different countries have different standards for menstrual products. What do you envisage us having when we're able to come up with one single standard for menstrual products that can be used across the globe?
Thank you very much, Ken. So with respect to the training program, basically it's about exchange of ideas, capacity building. And so we are in this training with SIS, trying to learn more from them in terms of standards development on the international level, as they also learn from our culture, how we also do things. So it's basically capacity building. With respect to the various standards that we have and having to come up with one standard, which would be very good for implementation in the LMICs, I think that from the onset, all LMICs would have to participate actively in the development of the standards. You don't wait till it gets to the final stage, then you bring in your input. From the onset, we are all supposed to participate and make our input known. You may see that there are some LMICs that may not be here currently, and that is more about within the ECOWAS region. I believe that for the ECOWAS region, one key thing is language barrier. Within that region, we have about 3 languages, French, English, and Portuguese. When we are having our meetings in the ECOWAS region, we usually use all 3 languages. And so with ISO, I know it's English that is used. And if they come and they are not able to participate and understand whatever is happening, it's a challenge for them. And so they may shy away from that. And once the standard comes and they have not been able to participate from the onset, it's very difficult for them to take up the standard, adopt it, and implement it. And so this is one challenge that we see with respect to having one single document for the whole world to use. If we don't have all the countries participating actively in the decision making. One other aspect is also to have stakeholder engagements. You need to engage your stakeholders right from the onset, identify the stakeholders within the subject area, bring them on board, and discuss with them the document that is being looked at, the requirements. If you have to go ahead and then even take them through the requirements, explain to them for them to have a better understanding, you do that, get their input, and present the input at the main technical committee so that it will be considered. And once the standard comes out, it will be very easy for them to take up the standard and implement the standard.
Thank you for that. Just as a follow-up question on what I asked you, would you be able to maybe share with us a story about whether the absence or maybe a story from Ghana or any that you may have within Africa on how the presence or absence thereof of a standard has made a difference in a particular sector or a country? You can either share one where there is a presence or absence, whichever you want to go with.
Okay, so I'll start with menstrual products. Somewhere in 2018, we didn't have any standard in Ghana with respect to the menstrual products. And we had stakeholders who were very much interested in bringing these products onto the market. There was a company that wanted to start up production. They visited the Standards Institute and we had no standards for that. And with that in mind, we had to quickly put together a standard for single use. After the single use standard had been published, we had COVID came in. And we all know what COVID did, where production was stalled. Everyone was looking at producing nose masks and stuff like that. And importation was also limited. With that, we had a lot of manufacturers going into the production of reusables. And these reusables were on the market with no standards. In 2021, 2022, we had a couple of coalitions of NGOs coming together and saying that we need a standard for the reusables because we have these products on our market, people are using it. We do not know how the product is affecting the people. We do not know the quality of the product. And so we need a standard to guide manufacturers in this line. When they came, the challenge was that we didn't have a regulator then. Then the regulator came in and said, the Food and Drugs Authority said that since they are regulating the single use, reusables also falls under them, and they would want to regulate that as a medical device. And that was a challenge because the manufacturers did not see why their product should be regulated as a medical device. We had to go back and forth with the Ministry of Health. They had several challenges with the reusables because they said in our country, potable water was an issue. How are these products going to be used in the rural areas where water was an issue? One, would these people be able to manage the use of these products, especially with respect to washing? So these are things that they genuinely raised issues on, and we had to discuss among ourselves. The regulator actually asked us to hold on with the development of the standard till we have discussed among ourselves the way forward with respect to handling of these materials. Once that was done, they themselves wrote to us and asked us to start the development of the standard for reusables, which I think that once you have the buy-in of the regulator and you have your stakeholders backing you in developing the standard, it's very easy because the implementation would be done by them and it will be very easy for the standards body to have such a standard being implemented.
Thank you so much. Maybe just the final question to you. This is in relation to the testing capacity. We heard from Elijah, you mentioned a number of tests proposed in the standard. And I know most LMICs have complained about not just the cost of testing alone, but even the ability to carry out the tests. What would you say, or would you recommend that would be done as much as you want to adopt the standards? what can be done so that within the LMICs we're able to adopt the standard and apply it effectively? Is there something you'd wish to share around the lines of testing? First of all, what are the testing capabilities that we have in Ghana, and maybe what would you wish to see being improved? Briefly.
Okay, thank you very much, Ken. I think that the challenges cast across all LMICs, with respect to heavy metals, with respect to pesticides, with respect to absorbency and stuff like that, we do not have any challenges in our testing for these ones. However, the challenge comes in with the biocompatibility, which I think is quite new to us. We may need to build some capacity in that line to be able to run such tests. Most of the productions in my country are basically SMEs, and they do not have the capacity to do that. They do not even understand what we are talking about. We need to explain to them further what that test is about. And so, just as Elijah said, I think that if we can come together, we may not have to have in each country, if within the regional setup, we can have a place where we can build capacity and send products there for these testing. That's from the onset. I mean, we can start with that, and then other countries can also build capacity in that line. That will very much help with the implementation of the standard once it's developed.
Thank you so much. Mr. Ogola, you want to come to you? You can hear me? Mr. Francis Ogola? Is he unmuted? Mr. Ogola? Okay,
Yes.
thank you. So, Mr. Ogola, my question to you is, you know, we are talking here as people are coming up with standards, and we've always said it's one thing to have a standard, and it's another thing to have the standard number one being implemented and even being put into use. So as somebody who represents the Ministry of Health, my question to you is, how would we integrate national or generally national health policies into menstrual product standards to ensure safety and equity for menstruators? And what more can the government do in terms of ensuring that awareness is created not just amongst the producers, but most importantly, amongst the users of these menstrual products?
First of all, I would say that standards and policies go together, and they inform each other. The policy informs the standards, and the standard informs the policy. Once we have the standard, it's very easy to implement because the standard defines the parameters that should be followed for every product. Then the policy now reinforces and gives a level of backing. The policy helps the consumers, the traders to assess
very clear,
which products based on the standards that. Hello?
You're not
you can
very
hear
clear.
me?
Your net seems to be unstable. You're not very clear.
Can you hear me now?
Yes,
you can hear me now. That's better?
Yeah.
That's better?
Yes,
you can hear me now? That's better.
Yes, not really, but maybe you can switch off the video, just use the audio. I think it could be interfering.
Can you now hear me?
We can hear you, but it's not very clear. Just
Can
switch
you
off
now
the video and
hear me? Hello?
Yes, proceed.
Can you now hear?
Yes, continue.
Can you now hear me?
Yes, we can hear you.
Can you hear me?
We'll come back to Ogola. I think Mr. Ogola will come back to you.
Can you hear me?
Maybe try to solve the issue. We'll come back to you.
Okay.
Ogola will come back to you. So sorry for that technical hitch. So we are gathered here because we are representing different countries, And we are trying to come up with standards that can be applicable to all our different countries, regardless of the social, economic, and even political differences that we might have. So I wanted to bring in Levi, or is it Levi or Levi, into the conversation, because Levi is from Uganda, but in this panel, he is not going to really speak about Uganda as a country, but we expect him to speak in the broader sense of the region, both the EAC and ARSO, in terms of harmonization. And Levi, my question to you will be, how can we ensure that we fast track regional alignment and adoption of these ISO standards? During your presentation, you showed us that in Uganda, you are still implementing that EAC standard on disposable pads. You are still implementing the 2018 version. Whereas I think Uganda and Tanzania, they are still implementing the 2018. But the rest of East Africa is implementing the latest version. So how then do we ensure that once we have the ISO standards published, now that is even a bigger problem because there's more countries involved. What can we do as a region to ensure that we improve that uptake of the standards?
Okay. Thank you, Ken. To begin with, like I explained in the presentation, because every country has its own way in which it adopts standards. Sometimes it looks like a repetition. You've developed a standard at the regional level, then you ask yourself, why should we go through another process of adoption as a country? But that is the status quo for now. So in Uganda, we've had the challenge. In standardization, sometimes we have political interference, which affects the work. And so in Uganda's case, the National Standards Council, which has the mandate according to the law to approve standards, is not yet in place. We were told that in this month of May, they'll be coming up with the committee. So as long as the National Standards Council comes up, because as a department, as from this ground level, we finalized everything. So it's a political issue. However, going to the question as a region, how can we speedily adopt the standards? How can we fast track? Now, in the East African community and under the East African Standards Committee, we have principles and procedures for developing East African standards. The principles are as indicated in ISO and WTO. ISO and WTO, they have 9 principles for developing standards, and they are the same principles we are following. And all these partner states are in the WTO, and we do the public inquiry and the rest. Yeah, but in that document, the principles and procedures for developing East African standards, once a new work item is brought, or even when you are revising a standard or reviewing a standard, once it comes up, before you think of drafting any regional standard, maybe from scratch, you have to check the available international standards. And in this case, we usually look at codex, especially for food products. We look at ISO. We look at IEC for electricity. Yes, we also look at STM, which has, of course, STM depends on memorandum of understanding between STM and the different partner states. But we first look at all those existing standards, and in case there is an existing standard, we look at its feasibility in East Africa, because there could be an international standard, but when not applicable in the East African region. So once, as a committee, as a team of stakeholders, we find that it is applicable in our setting, we recommend it to be, adopted. We recommend for its adoption in the different partner states. And by that adoption, as long as the East Africa, the Council of Ministers approves that, it implies automatically that the different partner states have to withdraw the existing national standards such that we don't have duplication. So as East Africa, first of all, by law, it's already a mandate that as long as we've agreed on a standard, then the different partner states do not have a reason to hold onto a document. And in case they do, a different partner state can raise it as a technical barrier to trade. We have a TBT forum in East Africa where, and we've had these discussions, engineer has moved out, but we've had discussions where Kenya says, why hasn't Uganda adopted this standard? So there are those discussions. So not to spend a lot of time, in case this document is discussed and it's published as an ISO draft on menstrual products. So as East Africa, the beauty is we are already participating right now. So it means that we don't have to spend a lot of time discussing whether it is feasible or not. So as East Africa, if we find that it is feasible for application in East Africa, then as a committee, we shall write and say this, we recommend for the adoption of this standard. And as part of the recommendations, we recommend for the withdrawal of maybe East African Standard 96, 2024 version, and any other standard which is there. Now for the national countries, of course, it will come back to them. By law in their countries, what do they do? Thank you.
Maybe just a quick follow-up question to that. We had Francisca mentioning that we have some regions that might not have been very active in the ongoing standardization. And I think I can even give an example at ARSO. We participate in ARSO, but not all member states participate actively. From the perspective of, from the regional perspective, what do you think maybe through SIS we need to do differently so that we try as much as possible to have the views and participation of as many corners of this country of this world as possible, so that once we have the standard, we are sure that the rollout of it is going to be a bit easy.
Okay, thank you. So to begin with, in ASO, now when some of you have done the course on ISO good standardization practices, different regional bodies are categorized differently. ASO lies in the type where you can choose to participate or not. And if ASO develops a standard, you can choose to adopt it or not. So you are a member there by choice, not by law. So in ASO, what she has mentioned is key, that as West Africa, there are different languages. So in ASO, SIS may not do much.
My question was not exactly to I was just giving an example.
Yes.
I was just mentioning how can we ensure that those who are not participating now are brought on board.
Yes, thank you. So it's a matter of understanding what could be the barriers. She has stated clearly that for the West African countries, the biggest barrier is the language. And if you identify that it's the language, then you have to work on a translation, maybe even from the onset, such that they are not left behind. And of course, continuing with the advocacy, taking advantage of every opportunity. For instance, this very year, we are having the ISO General Assembly in Kigali, Rwanda, in October. So the question would be, as a committee, SIS and the rest of ISO, how can we utilize this opportunity to still tap into these other countries and interest them in this ongoing work? So it's a matter of, it's a case by case. It's identifying what challenges they are having, and then we come up with solutions basing on their challenges. Thank you.
Thank you, Levi. So I want to come to you, Siva Kumar. When I'm coming to you, I want you to look at it from the perspective that you mentioned about testing. I think you come from a place where you're doing a lot of testing, and we LMICs are talking about challenges with testing. But I don't really want you to mention about the testing. I just wanted you to speak to the fact that we are working on coming up with ISO standards. And as I had mentioned earlier during one of the sessions I mentioned, we have different levels of producers. We have SMEs, we have large players, we have people that are already operating now. We have people maybe in the room who may want to start production of menstrual products in the future. So if you were to give us maybe from an example of what has happened in India, once the standards are gazetted, how do you ensure that there is compliance? Do you just have a blanket time frame for compliance for everybody? Or there is the way you work with the different players to give them different timelines so that you encourage compliance, so that you avoid cases where people are operating informally?
Thanks, Mr. Ken. So in India, we have, creating a standard is one and adopting is another challenge. So what we have in India is like the Ministry of Textiles, Government of India has rolled out a policy like quality control order. So what do you mean by this quality control order? They are regulatory measures implemented by the Government of India in the public interest in order to protect the human and animal and the planet health. But about 76 textile products have been covered by the Ministry of Textiles under this PCO, which means all the manufacturers who manufacture these products, including the menstrual products, will have to comply with the quality control order, and they have to get license and certification from BIS to manufacture products in India. So this process, BIS and Ministry of Textiles are taking extra care in sensitizing the manufacturers. They do conduct sensitization workshops in collaboration with industry associations and research associations like CITRA. And they also help the MSMEs. The process of certification remains same for all the type of manufacturers, large, medium, and small and micro enterprises also. But however, they give a extra leverage for the small manufacturers, the MSMEs, I would say. They would give additional time frame to comply with the requirements, because it may be difficult for the MSMEs to comply with the requirements immediately. So they are given an additional time of say 6 months or 1 year, depending on the product and their reach. And they are also given some concessions in terms of testing that is driven by the MSME ministry. We have a separate ministry for micro, small, and medium scale enterprises. They also support these MSMEs by giving concessions to them, by funding them to participate in exhibitions and conferences, etc. So through these mechanisms, these things are taken care. So with regard to testing and support, we have quite a number of laboratories in India which have the capability to test these menstrual products, including biocompatibility evaluation and skin irritation and sensitization.
Thank you. Maybe just to follow up on that. Part of the reason why we invited some of the SMEs to do exhibition here is because sometimes they view standards as a very punitive, something very punitive, something that the government is just there to punish them. And some of them don't even understand that it's not the NSB that develops the standard, but it's actually a technical committee. I'm sure some of them have seen what is happening here. So in terms of maybe your advice or a recommendation, what would you recommend to SMEs in terms of even building their own capacity? I know we are talking about testing is expensive, access to those machines is expensive. Do you think there are those capabilities that we can work with SMEs to build so that they're able to have their own local testing, so that they're also able to reduce their costs, so that they're able to scale their products in the market?
So if you take the standards for menstrual products in India, we have two standards. One is for the disposable ones, IS 5405, and the other one is for the reusable ones. Both stipulate minimum test requirements like pH, ability to withstand pressure, absorbency, and then biocompatibility, bioburden, and all those. These are the tests. But there are certain tests which can be done in-house, like tests like pH, absorbency, and the ability to withstand pressure, the sizes, and the physical safety. All those aspects can be tested in-house. So it will be better if even the MSMEs or SMEs, that won't cost much for them to have an in-house laboratory, so that they have a better quality control system in place. In fact, the regulatory mechanism in India also insists on having a minimum testing facility. And further, for the testing of biocompatibility and other things. I think there are sufficient laboratories in India, in other countries. We are even getting samples from Sri Lanka, Bangladesh, Philippines, for testing of these products. But what the MSMEs can do is, like, they can participate in standards drafting like this. They would also try to understand the requirements, and back home they can implement the measures, and they can also get funding help from international NGOs which are available. I think they can reach out to the NGOs and get some help from them also to grow further. But it won't be a big task if you are involved in the process. I believe that is my recommendation to the MSMEs.
Thank you. Mr. Ogola, I want to come back to you. I'm hoping you can now, your network is now better. You can just be on audio, you don't need to put on your video.
Now? Can you hear me
I
now?
think it is.
Can you hear me now?
Can you say something?
Can you hear me now?
Yes, that is now good. So do you still remember the question, or you want me to? I wanted you to
question. I think I.
Okay, continue.
Yes, as I started saying that standards inform the policy and the policy informs the standards. So both documents go together. Ministry of Health developed policy for the standards came up. So when standard comes into place, then I think it is going to give some synergy to the policy that is in place. It will help to fix areas that gray areas that were there in the policy. Again, the importance of the standards, especially to procurement entities, now they have parameters to check they are doing the procurements, and they have the areas to test. So they can even use any other lab so long as the and the performances are very clear. So that is so that the now informs the quality of the products being procured. Standards are also very important for the regulators, for them to check whether whatever is in the market is meeting the needs of the client. So it's a very important tool for regulators, so that regulators can rely on it, plus the policy to do now their enforcement work. The standards are also important to the consumers, because now the consumers are well protected, and they also have a channel to either complain or complement any product that they are using. So those are the key areas that are very important for the standards, especially when it is now developed and launched.
Okay,
again,
maybe just a follow-up question quickly. In reference to what you've mentioned about awareness, we've said here that this discussion cannot be only left to NSBs alone, but we need to partner with other different bodies. What do you think from the perspective of the government needs to be done? Because I know as Kenya, we come up with very good standards. We adopt the ISO standards. We come up with very good policies. Maybe what difference can we do for this particular sector on menstrual products, and how can we ensure that this conversation doesn't end here today, and that we can continue this conversation even as we work towards having the standard?
Yes, it's a very important question, and we have two users here. We have the technical users. The technical users are the people either in the Ministry of Health or Ministry of Education, have the technical aspects of the product. Then we have the final users, or the general consumers. These are now the girls and the women that are now in that. To reach all these groups, I start with the general users. General users can use media, like the televisions and the radios, to give some insights. To give some insights on what is available, how they can access them, how they can use them. So that covers a huge population. Then now we can come down now to have some workshops or some updates workshops for the technical users, that is the people in the Ministry of Health, the people in the Ministry of Education, so that they also can up this and then further reach the consumers. So the key areas that are very important that we reach most as much
Okay.
as
Losing again.
possible with information.
Thank you. So in the interest of time, I want to open it up to the audience, but I just want to take only 3 questions, preferably 1 or 2 from the team joining us online. And anybody in the room that may want to ask a particular question to any of my panelists. Anybody who wants to go first? Have we been speaking to ourselves? Just in front here, or you've been together with you? I'm seeing some of us are on earphones, meaning they are in other meetings. They're in a meeting within a meeting. Anybody wants to ask a question? Anybody